Hey guys, Oscar here with Gastroenterology Simplified. I just got out of work and I'm here checking the news, and I'm going to start by saying this. Cancer does not discriminate. Cancer could affect young, old, black, white, Asian, rich, poor, middle class, and even the healthiest of all. By reading the news today, I ran into Catherine, the Princess of Wales, announcing that she has some type of gastric cancer. And the word cancer is, in my language or in my opinion, in my vocabulary, is not a good word. And this is a individual that not only is one of the wealthiest of all, and I'm sure she has the best care of all. I'm going to do a different video here, and I'm going to talk about the most common symptom that I see in my clinic. The most common symptom that I see in my clinic is abdominal pain. But to be even more specific, I see epigastric abdominal pain, which is at the top of your abdomen. Epigastric abdominal pain could be secondary to different things. It could be secondary to a gastric ulcer. It could be secondary to gastritis. It could be secondary to pancreatitis, which is inflammation of the pancreas. It could be secondary to gallstones, acute cholecystitis, which is inflammation of the gallbladder. It could be secondary to the passage of stones. It could be secondary to H. pylori, which is an infection of your stomach. It could also be secondary to NSAID-induced gastric ulcers or gastroparesis due to your stomach being slow and not digesting the food properly. Therefore, the food gets to sit in the stomach for a longer period of time. So, if you are experiencing epigastric abdominal pain, or if you're experiencing abdominal pain, if it is acute, meaning you have not been experiencing this type of pain for a long period, just a day or even 48 hours, the best thing is for you to see a doctor and to be further evaluated. Now, if you have been experiencing the abdominal pain or the epigastric abdominal pain, and it has been longer than 3 months or so, this is usually considered chronic abdominal pain. Yes, you may have had a basic workup due to the acute abdominal pain by your primary doctor or the ER physician. But if your pain persists, then this should be further evaluated. And I'm going to tell you why. Because a simple word that affects many of us, old, young, own family members, friends, white, black, that is cancer. And I want to narrow this down to gastric cancer. Gastric cancer could be caused by many different things, but I'm going to keep it simplified here. It could be caused by H. pylori, long-standing H. pylori. It could be caused by different factors: smoking, alcohol abuse, alcohol intake, environmental factors such as chemicals, and so on. So my message here today is, if you have been experiencing acute pain, meaning the pain has been present for 24 hours, 48 hours, 72 hours, then I highly recommend for you to see a physician, nurse practitioner, physician assistant as soon as possible. Let's say you have seen a medical provider and a basic workup was done. And if you continue to have the pain, then you should have a further workup, such as an upper endoscopy, a CAT scan, blood workup. And the reason I usually go with an upper endoscopy, meaning a scope that goes down your mouth, through your esophagus, to your stomach, is because we are able to get random biopsies. Getting random biopsies, we can take the tissue and take it to the pathology department so a pathologist can study the cells, and that will give us more information. And with more information, we can go ahead and treat and give you a more specific treatment if needed. Lastly, it is always good to have your screening workup, your yearly check. If you are older than 45, get your colon cancer screening colonoscopy. That is extremely important. This is a type of cancer, colon cancer, that is easy to detect with a colonoscopy. And if it is caught on time, then the treatment is more successful. Also, extremely important, and this touches many people differently, but eating a healthy diet, having a healthy lifestyle, having a healthy life, being in a healthy environment, eating what the earth gives us, avoiding extremely processed foods, avoiding processed foods will also help you prevent cancer and likely overall help with your health overall. I'm going to leave it here, and I want you guys to always think about health. Have a healthy lifestyle and avoid smoking, drinking alcohol, processed foods. If you found this video helpful, please click like, subscribe to the channel so I can bring you guys more informative videos. And the best gift you can give me is to click like, share the video, and also subscribe to the channel. I appreciate you listening to me, and I'll see you in the next one. Have an amazing weekend.